Coronary heart disease, also known as coronary artery disease, occurs when the arteries get blocked from a buildup of cells, fatty acids, and cholesterol. This buildup is called plaque. As the inside of the coronary arteries gather plaque and become narrow, they decrease the flow of blood and oxygen to the heart muscle. Without proper blood and oxygen, the heart muscle eventually weakens and begins to wear out, decreasing the heart's ability to pump normally. While doing physical activity, the heart muscle demands more blood and oxygen, but if the heart is not pumping effectively, this need cannot be met, making it hard for breathing along with chest pain, which can lead to an unexpected heart attack. Here is Dr. Dolman with a brief and professional explanation of what coronary heart disease is.
With coronary heart disease, it's the leading cause of death for both men and women in the United States, killing almost 700,000 people each year. Are you worried? You should. Coronary heart disease occurs when the coronary arteries that supply blood to the heart become narrowed due to plaque buildup and may lead to a heart attack. Plaques are a mixture of fatty substances, including cholesterol. Blood flow and oxygen supply to the heart can be reduced or even fully blocked with a growing plaque and cause heart attacks.
As Dr. Dolman said, coronary heart disease is not something to be careless about. It can happen to anyone no matter the age, gender, or race. Here are some of the main causes to be aware of when thinking about how and why coronary heart disease affects so many Americans every year. Unhealthy habits such as a diet high in cholesterol and other fats, smoking, and lack of exercise accelerate the deposit of fat and calcium within the inner lining of the coronary arteries. Let's focus more closely on how these bad habits increase your risk for coronary heart disease. During the past 20 years, there has been a dramatic increase in obesity in the United States, and rates are only getting higher. Unhealthy diet habits, specifically people struggling with obesity, are at an increased rate for coronary heart disease. Fats and cholesterol that are consumed daily by Americans, specifically through fast food restaurants, increase the plaque buildup. When physical activity is done, it will have a greater strain on the heart muscle if it remains uncared for, and the risk of coronary heart disease will increase greatly. About 20% of all deaths from heart disease in the United States are directly related to cigarette smoking. A person's risk of heart disease greatly increases with the number of cigarettes he or she smokes. People who smoke a pack a day have more than twice the risk for coronary heart disease than non-smokers. Cigarette smoking increases your risk by the nicotine present in the smoke. Nicotine decreases oxygen to the heart, increases blood pressure and heart rate, increases blood clotting, and damages the cells that line the coronary arteries, all leading to possible diagnoses of coronary heart disease and unexpected heart attacks. Another important factor of coronary heart disease is fitness and exercise. In a study in 1987 by Powell and his colleagues, it was found that as the amount of exercise increased, the risk of coronary heart disease decreased. More recent studies have shown and demonstrated that exercise has the ability to improve glucose tolerance, break blood clots, and reduce blood pressure, ultimately decreasing the risk for coronary heart disease. Over the past 4 decades, the Centers of Disease Control and Prevention and the American Heart Association have reinforced scientific evidence linking fitness and coronary heart disease. The results in the scientific reports show that fitness does reduce the risk for coronary heart disease, and that only 1/3 of Americans meet the minimal recommendation for activity outlined by the Centers of Disease Control and Prevention and the American Heart Association. Those were a few of the main causes for coronary heart disease. The good news is that through a healthy lifestyle, coronary heart disease can be prevented and in some cases cured. Here are a few ways to live a healthy lifestyle and reduce your chances of being affected with coronary heart disease. The most important form of prevention is a healthy, balanced diet. Avoid high-fat foods and foods with high cholesterol. Keep your meals balanced with fruits, vegetables, and whole grains. Second, quit or fully avoid cigarette smoking. Even secondhand smoking affects your health, and it can almost double your risk for coronary heart disease. The last and one of the most important ways to prevent coronary heart disease is fitness and exercise. Exercise improves your body's ability to transport oxygen to your heart and your brain. 30 minutes a day of exercise, walking, or running is recommended by the American Heart Association to reduce your risk for coronary heart disease, to live and feel healthier. For more information on coronary heart disease and how to prevent it, please visit the American Heart Association website at www.americanheart.org.